Anesthesiologists are probably in the best position of any physician in terms of really defining what healthcare reform looks like as opposed to being defined by healthcare. But USAP has identified the perioperative surgical home as one of the key initiatives to define what the future healthcare paradigm looks like. In essence, perioperative surgical home means the beginning of care, even to the point of preparing a patient for surgery. We sometimes call that prehabilitation. In other words, make sure the patient's nutritional status is good, make sure that their cardiopulmonary status is good, and tune those things up so that when they do encounter the surgical process and the surgical procedure and the postoperative care, they are in the best condition possible to successfully get the good results from that. Anesthesiologists can make that happen. And you could even extend that farther to where once the patient goes home, what are the things that are being done in order to be sure that they are complying with the treatment regimens and things for an adequate recovery. As we see that payment paradigm changing from one of fee-for-service to something known as a bundled payment or an accountable care organization, then a single amount of money is delivered for the entire service that's given. The bigger the role that an anesthesiologist can play and the more relevant role that they can play, the more valuable their services are going to be in that future healthcare paradigm. We see ACOs developing, we see other sort of forms of healthcare delivery developing. USAP is at the position we are going to be a very critical and relevant element of that. For without the anesthesiologist participating in these activities, an ACO or any kind of health delivery system is not going to realize the full potential of healthcare savings and optimal outcomes unless the anesthesiologist is there.